Vaginal and cervical concerns. The vaginal cervical concerns is cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Various strains of the human papillomavirus HPV, a sexually transmitted infection, play a role in causing most cervical cancer.
Vulvar cancer, penile cancer, genital warts, anal cancer, cervical cancer, and oropharyngeal cancer is where human papillomavirus occur.
Cervicitis is an inflammation of the cervix, the lower narrow end of the uterus that opens into the vagina. Possible symptoms of cervicitis include bleeding between menstrual periods, pain with intercourse or during a pelvic exam, and abnormal vaginal discharge. However, it's also possible to have cervicitis and not experience any signs or symptoms. Testing and therapy for vaginal and cervical concerns. If sperm do not appear to survive in vaginal secretion because secretion are too scant or tenacious, a woman may be prescribed low-dose estrogen therapy to increase mucus production during days 5 to 10 of her cycle.
Conjugated estrogen or Premarin is a type of estrogen prescribed for this purpose. If the vaginal infection is present, the infection will be treated according to the causative agent. The fungus Candida albicans is responsible for the most vaginal yeast infections. Unexplained subfertility. In a small percentage of couples, no known cause for subfertility can be discovered. It may be that one partner alone is not significant, but when combined with a small problem with other partner, together this becomes sufficient to create subfertility. Reasons why most couples experiencing subfertility. It's because women is not ovulating, male is infertile, age, black fallopian tube, endometriosis, and underlying medical problems. It's discouraging for couples to complete fertility evaluation, but it's best to offer active support to help the couple alternative solutions such as continuing to conceive, using assisted reproductive technique, choosing to adopt, and agreeing to child-free life.
Assisted reproductive techniques. If ovulation, sperm production, or sperm mobility problems cannot be corrected, assisted reproductive strategies are the next step for a couple to consider. Bago simulan ang procedure, ang babae ay dapat discontinue ang smoking or ang kahit anong recreational drug behaviors at dapat sila ay nag-i-ingest ng diet na high in protein at dapat sila ay may BMI within a normal range of 18.5 to 24.9. Ang babae, kailangan din, if hindi pa nakapag-undergo ng test, kailangan niyang mag-undergo ng test for HIV and hepatitis C. A hormone profile including levels of FSH, LH, estrogen, and progesterone to test for ovarian reserves, as well as intravaginal sonogram to visual structures. So, ang pinaka-common na assisted reproductive technology techniques is ang in vitro fertilization or ang IVF. It is the most common and effective type of ART. ART procedures sometimes they use donor eggs, donor sperm, or previously frozen embryos. Dito, it may also involve surrogacy or a surrogate. So, marami tayong pwedeng gawin as a nurse to provide culturally sensitive care to an increasingly diverse nation. Una, kailangan meron tayong awareness. As with any social issue, the first step is awareness. So, anong pwede natin gawin is we can strive to learn more about becoming a culturally sensitive nurse. We should let others know what we're doing, kung anong ginagawa natin, and bakit natin ito ginagawa. So, pangalawa is to avoid making assumptions.
It is important that nurses avoid making assumptions about cultures they are not familiar with para hindi tayo magkaroon ng problema sa future or sa paggawa ng procedure. So, the third one is to learn about other cultures. As a nurse, it is part of our responsibility or your responsibility to your patient is to learn what you can about them. Kilalanin natin yung pasyente natin, saan sila nanggaling, ano yung kanilang background or ethnic background or kung ano yung culture nila. So, number 4, it is very important. It is to build trust and rapport. It is essential for nurses to build trust with their patients, of course, regardless of ethnic or racial backgrounds. Kailangan natin mag-build ng trust para wala tayong problema sa pag-render ng care. Kasi kung hindi nila tayo pagkakatiwalaan, hindi rin natin magagawa yung trabaho ng maayos. Hindi natin magagawa yung mga procedures ng maayos. Kailangan natin i-build yung trust nila bago tayo gumawa ng kahit anong procedure para maging comfortable sila sa atin.
Alternative insemination. Alternative or intrauterine insemination is the instillation of sperm from a masturbatory sample into the female reproductive tract by means of cannula to aid conception of the time of ovulation. The sperm can either be instilled into the cervix, intracervical insemination, or directly into the uterus at the time of predicted ovulation. BBT charting macules analysis or urinary test kit for LH can be used to detect the day of ovulation. Alternative or intrauterine insemination or mas kilala sa tawag na IUI. Ang intrauterine insemination ay procedure na ginagawa kung saan pinapasok sa ari ng babae ang sperm gamit na tools dito ay tinatawag na speculum. Tapos pinapasok ito naman sa vagina ng babae para makita ang cervix. Ang syringe o ang speculum ay naglalaman ng sperm tapos ang syringe naman na ito ay naka-attach siya sa tube na tinatawag na catheter. And this catheter guided papunta sa uterus. Then, if nasa inside na ang catheter, the doctor inject the sperm it. Then, if matapos ang procedure na kinakailangan ng babae na humiga muna at least for 10 minutes. The best day of time na gawin ang procedure na ito is during the monthly menstruation of a woman dahil ang ating ovary ay nagre-release ng egg na tinatawag na ovulation. Either the male partner sperm, alternative insemination by male partner, or donor sperm. Alternative insemination by donor can be used. Ang pag-undergo ng intrauterine insemination is pwedeng gamitin ang sperm ng mismo mong partner or from the donor sperm as long as na walang genetic disorder ang may-ari ng sperm. This treatment is beneficial for number 1, couple with fertility issue. Couple who find it difficult to have vaginal intercourse. Couple with medical issue who need. Sa mga mag-asawang may problema sa kanilang katawan. If either partner has HIV, if the female partner has semen allergy, female partner who have suffered from cervical scarring, male partner who suffer from ejaculation or erection problem. Kagaya ng mag-partner na may HIV, ayaw nilang mahawaan pa ang kanilang mga anak, so kaya ginagawa nila ito. To prepare for alternative insemination, a woman receives an injection of clomiphene, clomid, or FSH 1 month prior to the insemination, so follicles growth of ova in stimulate, and a day of ovulation can be predicted.
In vitro fertilization is a method of fertilization in which an egg is combined with sperm in a laboratory setting, monitoring and stimulating a woman's ovulatory process, removing an ovum or ova from her ovaries and allowing sperm to fertilize them in a laboratory culture media. Ang procedure na ito is para sa mag-asawang hindi kayang magkaanak due to damaged fallopian tube or yung babae is masyado ng matanda and yung lalaki is low yung sperm count niya. IVF is used to assist a woman in getting pregnant. It is used to treat a variety of factors that can lead to infertility, such as the woman's advanced age, damaged or clogged fallopian tubes, which can be caused by pelvic inflammatory disease or prior reproductive surgery. Advantages of IVF. IVF helps many patients who would be otherwise unable to conceive. The ultimate advantage of IVF is achieving a successful pregnancy and a healthy baby. IVF can make this a reality for people who would be unable to have a baby otherwise. Black tubes. For women with black or damaged fallopian tube, IVF provides the best opportunity of having a child using their own eggs. IUI and other forms of assisted reproductive technologies, IVF can be more successful. It can benefit same-sex couple and single women. Embryos that aren't used can be given to research or another couple. IVF can be used to diagnose issues with fertilization. It is possible to check embryos for any inherited illnesses. It has a lengthy history of use and a good safety record. Disadvantages. A failed IVF cycle is possible. There could be side effects and risks. There is a chance of multiple pregnancy. There is a slightly increased risk of ectopic pregnancy. High estrogen levels associated with high stimulation IVF have been linked to an increased risk of prematurity and low birth weight in babies. It can be emotionally and psychologically draining, and it can also be expensive. Some patients might be concerned about ethical issues.
In some centers, nurses practitioners or healthcare provider will complete oocyte removal and transfer. In all centers, nurses have a responsibility to supply support and counseling to help sustain a couple in a process. Because the couple was committed to the procedure, the typical couple adjusts to pregnancy and parenthood as well. So we encourage women and offer support for breastfeeding so she can successful with this as other women. The patient also need a strong support system consisting of partner, family members, and or friends that they can lean on during the trials and tribulations of the procedure. If sonogram reveals that a multiple pregnancy of more than 2 zygotes has been achieved, selective termination of gestational sacs until only 2 remain may be recommended to help ensure the pregnancy will come to term. This is done by intra-abdominal injection of potassium chloride into the gestational sac chosen to be eliminated or the reduction of embryo. It is successful pregnancy termination without any complication to achieve a best pregnancy. If couples report a feeling of social isolation during this time and weariness answering friends and family's question about when they will have a baby, supply empathic support for them through this difficult time.